everybody. A nurse is a caregiver. If you take the initial period when nursing had started, the role of a nurse was just a caregiver. But nowadays, as there are a lot of advancements in the technology in our society, the role of a nurse has also changed. Today, you're going to learn about the role of a psychiatric nurse. Changes in nursing of the day have an expanded role which includes not only the bedside nursing care but also the main focus of nursing care is the health promotion and illness prevention, which is the very much important concern of a client. Yes. So the role of a psychiatric nurse is shifted, or we can say the name itself, the name of a psychiatric nurse has got a newer term called as the mental health nurse, which has been influenced by various factors. It can be related to the economics or related to the information technology or the finances for the healthcare or the various the practices of being accountable in our responsibility as well as the activities in the research. All these factors has given up or is given birth to many roles of a psychiatric nurse. So we are going to see the development of the psychiatric nursing role. So before going to the development of the psychiatric nursing roles, it is important to know the term role. What is a role? A role is a set of expected and actual behaviors associated with a position in the social structure, which is the definition given by Hardy and Hardy. It is the expected behavior of a person to accommodate himself in a particular position or status in a social structure. So another definition we have, which is the sum total of expected behaviors. The behaviors expected from a person who occupies a particular position or you can say a status in a social pattern. The role is nothing but it is the expected behavior of a person that a person should have to occupy a particular position or a status in any kind of a working environment. So there are many new roles for a psychiatric nurse worldwide. So if you take the worldwide roles of a psychiatric nurse, she can work as a nurse entrepreneur, that can work as nurse manager, nurse clinician, nurse educator, and the nurse researcher. She is not only confined to the bedside care, but as a nurse clinician, but she has got many new roles that she can play. And if you take particularly the psychiatric nurse, that she is having many responsibilities, many roles like being a part in the psychotherapy, and also she in some countries she has given the legal authority to prescribe medications and to do psychotherapy for the uncomplicated cases. If you take the role of a nurse, we can divide it into two roles. One is the traditional role, the second one is the expanded role of a nurse. Right. So if you take a traditional role of a nurse, that is the contemporary nursing, it requires the nurse to possess the knowledge and the skill in the different areas. So as a traditional nurse or a contemporary nurse, she works as a caregiver, as a communicator, educator or a teacher, manager, advocate, leader, nurse counselor, then we have nurse researcher and the career development. Okay, so the expanded role, if you take apart from the traditional roles, what I have given some examples, if you take the expanded and the extended roles of a nurse, so she has to assume certain degrees or qualification, educational qualification, as well as the role of a nurse goes beyond the traditional roles with the additional responsibilities. Few examples of expanded roles of a nurse that I have got is being a nurse clinician, nurse researcher, nurse administrator, or the nurse manager, nurse educator, advanced practice nurse, nurse practitioner, clinical nurse specialist, school health nurse, critical care nurse, family nurse practitioner, and trauma nurse specialist. So these are the new roles, we can say the expanded roles of the nurse on two things. So one is the elements of normal nursing, the second one is the advanced practice role. So if you take the elements of the normal nursing, she works as a psychiatric nurse assessor. So she does the psychiatric assessment, she involves herself in the patient and carer education, and also involves in the basic psychotherapeutic practices. So these are the normal nursing care or responsibilities that carries out. So if you take the advanced nursing roles in the psychiatric setup, she is given the responsibilities of psychiatric diagnosis, prescribing single emergency doses of medications, and also modifying the doses of wide range of psychotherapeutic medications, as well as the freedom or the autonomy in the admission and discharge procedure. So she is responsible for, as an advanced nurse practitioner, that she's given the additional responsibility of diagnosis, prescribing medication, managing the doses, and also in the admission and discharge process. So that is the way the nurse is having an expanded role in psychiatric nursing. So that is basically about the role of nurse in terms of the traditional role, as well as the you can say the expanded role. So moving on to the roles of nurse. What are the various roles of a psychiatric nurse? So we have got many roles. So first role is being a primary nurse or a registered nurse or novice, right? A primary nurse is the one who is responsible for the clients or the individual client's nursing care, where she works with the individual, she works with the families as well as the community. And also she should have the registered nurse should have a training or educational qualification of a bachelorate degree with the clinical skills to care for the mentally ill clients. So that is about the primary nurse, or we can say a registered nurse. So the second role of a nurse is the ward manager or ward sister. So what is this? So she is a nurse, okay, a ward sister who is having a central responsibility of integrating and strengthening the interprofessional relationship as well as the communication. So if you take a ward sister or ward nurse, she is the one who has to communicate, with the other healthcare professional. She's the one who has to integrate and work with the other healthcare professional. She should have a good communication skill. The third role of a nurse is psychiatric or mental health clinical nurse specialist. We can say the psychiatric mental health clinical nurse specialist. So she is the advanced practice registered nurse who specializes psychiatric nursing care issues with the various groups like the children, adolescents, and the adult. And she also she works with the patients who are mentally ill and also who are having the behaviors of the substance abuse, right? She is the expert who will provide the care to the patients in the specialty area, such as she would be a specialized nurse who can work with the child and adolescent nursing, or who can work with the HIV and AIDS clients, or who is having knowledge and expertise skills in a particular area of giving a particular specialty of care. So that is a psychiatric or mental health care nurse specialist. So moving on to the next role of a nurse, which is the mental health nurse practitioner. So mental health nurse practitioner is also known as the psychiatric nurse practitioner who works in the primary care facility. You can work in the outpatient department or in any kind of a hospital, as well as the community health center. She is the one who is responsible for evaluating and providing the care to the patients with the psychiatric disorders and also certain medical conditions and substance abuse problems. So they are licensed to give the care or the services even for the emergency psychiatric conditions. They will play a role in the psychosocial as well as the physical assessment of the patient, their family, as well as the community. Okay, they can also work as educators and also lead the hand for the diagnosis of the client. So this is about the mental health nurse practitioner or a psychiatric nurse practitioner. So moving on to the next role, which is the nurse therapist. As the name says, the nurse therapist, so she should have a specialized training in the psychotherapy. So she is the nurse who has got a specialized training in the psychotherapeutic techniques. So she is specialized and trained and skilled independently to work as a practitioner who has a responsibility of doing the diagnosis, prescribing the medications to the client, and the treatment approach to the client as well as the community as a whole. So she can practice independently also if she has been registered and licensed to do the practice, right? So next one is a nurse manager. So nurse manager is the one who works less with the patient but has got a responsibility of being a leader. She has got a leadership responsibility to lead the team of nursing. So she is the one who makes sure that the therapeutic milieu or the environment of the patient is maintained. She is the one who will negotiate and allocate the nurses to the various clinical areas. So that is the responsibility of the nurse manager. Next responsibility is of nurse researcher. So as a nurse researcher, she has got a complex skill. She should have a complex skill to investigate the problems of inquiries. So what all the nursing problems, she has to identify and inquire about the nursing problems and also try to solve those problems by by investigating into the problem. She is the one who is going to improve the scope of the nursing practice. She can be employed in an academic setting or in a hospital and work as an independent professional in the community service agencies. So what is the requirement or the education qualification of a nurse researcher? She should have either a doctorate degree or she should be having a master's in nursing. So that is a responsibility of the nurse researcher. Moving on to nurse educator or the health educator. So the nurse educator or the health educator works in the education institution as a staff development department of healthcare agencies, and also she can work in the client education department for teaching the client, for example, who is disabled or their families about how to care or how to provide the care at home. A nurse educator should have clinical knowledge as she can practice the skills in the clinical area as well as she should have the theoretical knowledge. Also, she can have additional education in the educational process, such as she can have a doctorate degree or advanced degree in the nursing education and administration. So moving on to the community mental health nurse. Why this role of a community mental health nurse has been set up? Because of deinstitutionalization. So earlier, the mentally ill clients were only put in the mental institutions for the care. Nowadays, we have the deinstitutionalization, which has given birth to a new role of a nurse as being a community mental health nurse. The focus or the responsibility of a community mental health nurse is mainly the prevention, right? So we have got the primary, secondary, and tertiary prevention of the mental illness. She also provides the psychiatric home care. So nursing services can be provided by the The nursing care can also be given for the active psychiatric cases. She also has a responsibility of providing psychoeducation as well as conducting the psychotherapy in the community. She works in the other areas such as the alcohol and drug rehabilitation centers and child and adolescent mental health. So that is the responsibility of a community mental health nurse, mainly related to the prevention, home care, as well as delivering the care services to the specialized group such as a drug or alcohol abused clients, as well as child and adolescent group. Right. So the next responsibility is psychiatric consultation licensed nurse or licensed mental health nurse. So, being a licensed mental health nurse or a psychiatric consultation, so she has got the responsibility of giving the care directly to the patients or the families, and also she is the one who will be coordinating, consulting, collaborating, as well as having the educational relationship with the client and the other healthcare professionals. So she's the one who can work in the hospital, rehabilitation facility, long term care facilities, home care, as well as the clinics. The next one is the forensic psychiatric nurse. So as the name says, forensics is something which is related to the laws or the legal issues. So, as a nurse who works in the areas of legalities, we can term her as the forensic psychiatric nurse. It is a new branch, we can say, in the nursing, with a broader term of healthcare combined with the biopsychosocial education of the registered nurse in the scientific investigation as well as the treatment of the conditions like trauma, the death, predators of violence. So that is a responsibility of a forensic psychiatric nurse who cares for the victims of traumatic injuries as well as catastrophic accidents, assessment and treatment of predators of crime and violence. When the client is there under the legality or under the law, he or she has done an offense. So such a client has to be given the care. A forensic psychiatric nurse is the one who will be delivering the care not only to the criminals but also to their family. So this is the forensic psychiatric nurse. So we have got many subspecialties in the forensic psychiatric nursing. So you're going to learn about it. The first one is clinical forensic nursing. So it is the application of forensic aspects of healthcare in the scientific investigation and treatment of trauma and death or related medical legal cases to living patients or those whose death is pronounced upon arrival or during trauma treatment. Any conditions that is related to any kind of the violence or medical legal issues or any death which is announced upon arrival or during any kind of a trauma. In such cases, the clinical forensic nurse delivers a nursing care. So next one is the forensic correction nurse. Who is a forensic correction nurse? So she has got the provision of biopsychosocial nursing care to individuals who have been charged or convicted of a victim or convicted of a crime. So any criminals or who have been charged under the law, so such a client is given the care by the forensic correction nurse. Next is a forensic ER nursing. So forensic emergency room nursing. So here the nurses who will be delivering the care related to the forensic aspects to all the patients who require the emergency room services. So that is a forensic emergency room nursing. Next is the forensic geriatric nursing. So the geriatric group who are under certain laws. So the application of the nursing knowledge and the provision of care and concern to aging individuals with regard to the legal human rights issues of, they can be an abuse or a neglect, or they can be exploited. In such conditions, this group, the geriatric group, who are under the legal issues. So, such a client is given a care by the forensic geriatric nurse. The next one is the forensic legal nurse consulting. So, here the forensic legal nurse consultant is the one who works with the client who require the, civil protection rather than the criminal cases. Okay, there are certain conditions wherein the clients are, sandwiched between the law as well as the medications, right? Psychiatric medications. In such conditions, the forensic legal nurse consultant works to coordinate with, and also she will be having the responsibility of taking care of the civil rights rather than in the criminal cases. So next one is a forensic mental health nursing. So what is this field, forensic mental health nursing? So here there is an application of nursing knowledge and provision of psychiatric rehabilitation care to individuals who have interfaced in some way the criminal justice system, and as a result they have been designated as mentally ill, and they require the psychiatric evaluation or the treatment. There are certain conditions that because of the psychiatric problems done some criminal activity. So in those cases, such patients, they will be taken care by the forensic mental health nurse who will be delivering the care and doing the evaluation on that. Next is a forensic investigator nursing, or we can say forensic death or medical examiner nurse. So she is the one who should have the knowledge and the experience in investigating any medical legal deaths. So deaths which are not natural, so the unexpected or violent death. So in those conditions, she works with the medical examiner to investigate in the cases. So such a nurse is termed as a forensic investigator nurse. Next is a forensic examiner nursing. Forensic examiner nursing. She will do the examination and evaluation of the trauma related to sexual assault or any kind of the impersonal violence. So she serves as a liaison between the healthcare institution and the court or the law. So she is the one in case of there are patients, there are victims with any kind of sexual assaults, or victims who are of any impersonal violence. So such kind of clients, they will be working with the forensic examiner nurse who will be acting as a liaison between the healthcare institution as well as the court. So next one is the sexual assault nursing. So here, as the name says, sexual assault nursing. So she will be having the knowledge and expertise in dealing with the clients who have undergone some kind of a sexual abuse, or she'll be working with the sexual assault survivors. So she should have a specialized training in this particular field. So a training program of approximately 40 hours that she should undergo, and she should get the competence comprehensive examination for the such kind of the survivors. So that is about the sexual assault nursing. This is all about the subspecialties of forensic nursing. Moving on to the next role of a nurse, which is geropsychiatric nursing. So, geropsychiatric nursing is a specialized area wherein the psychiatric nursing care will be given to the geriatric group. Nursing, it's very much important that they have to undergo a training based on the curriculum and also get a certificate on the particular training of specialty. So that is about the geropsychiatric. The next one is the nurse case manager. So who is a nurse case manager? She's going to manage the client based on the case, right? The client is assigned to the particular case manager, and she will take care of the overall responsibility of the client. It can be giving the care, being an educator, being an advocate, so being an advocate. Okay, so all the nursing care, instead of getting fragmented to different nurses, the whole care will be taken by such a nurse who is a nurse case. The last one is the child and adolescent psychiatric nursing. So what happens in the child and adolescent psychiatric nursing? So the psychiatric nurse should have a specialized training who are having any kind of mental disorder. They can work in various settings such as in inpatient department, outpatients, in the schools as well as in the community mental health centers. So they are having the responsibility of doing the psychotherapy for such clients, doing the consultation as well as the psychopharmacological interventions. So this is the responsibility of the child and adolescent psychiatric nurse. These are the various responsibilities, or we can say the roles of a psychiatric nurse. Apart from being a clinical nurse who works in the hospital to deliver the care to the mentally ill clients, she can also work in these various specialties and develop the knowledge and skill in practicing our profession. So this is about the role of psychiatric nurse. Hope you all have understood the topic. Thank you.